This video will show the proper technique to perform a sterile wet to dry dressing change.
Hello, Mr. O'Reilly. It's Dawn. I was checking over your orders, and it looks like you have a dressing change to do on your belly. So, if it's okay with you, I brought the supplies to get that done. Are you having any pain at all today? No, that's good. I'd be more than happy to get you some pain medicine for your abdomen if you need it. So just let me know. Is it okay if I lay you down? All right. And if you would please tell me your name and your date of birth. Brandon B. O'Reilly. Very good. And your birthday? Excellent. I'm going to take your whole bed up in the air here. I'm going to pull your blanket down to just below your waist, if that's okay. Are you warm enough up top here? Excellent. And I'm going to bring your gown up so that I can have access to the dressing. I'm going to just get some of my equipment ready here. Will it be too uncomfortable for you if I have you turn onto your side a little bit? Okay. Good, you got it. So first what I'm going to do is just take off the dressing. Good thing I came in to do the dressing, it was coming loose. Here I'm noticing any drainage that may be present on the old dressing before I throw it away. The color, the odor. I'm going to remove the packing dressing. If it gets stuck, I can always take some saline and lightly moisten it so that it easily comes out. Again, observing the color, the consistency, the amount of drainage on the dressing, if there's any odor. I will now assess the wound. Assessing the wound includes both observing the color and appearance of the wound bed. Here we have a nice beefy red, healthy looking tissue on the wound bed itself. On the wound edges, I do see that there is some erythema or redness. So I'll keep a close eye on that. There's not a whole lot of excessive drainage and no odor that I can that I can detect. Going to measure the length of the wound. I need to be fairly specific with this information. .2 centimeters in length. Measure the widest part of the wound. Two and a half centimeters, and then the depth. Which is also 2.5 centimeters. I'm going to take another sterile applicator and just kind of gently press around, making sure that it is not causing too much discomfort for the patient. But here I'm checking for any tunneling, any undermining, any dead space that may exist in the wound. Once I've measured, I can then go ahead and clean the wound. And here I'm going to have the patient turned a little bit more to the side. Point being that I am going to irrigate the wound from the most contaminated area to the least, the least contaminated area to the most. So I will start rinsing from the top and letting it rinse its way down. Again, my chucks will catch any excess moisture that runs down the abdomen. And I can rinse that as many times as I need to make sure that it's nice and clean. Okay, have the patient go ahead and lay back there for me. And I'm going to take a sterile 4x4. Again, notice that I am touching only the top surface with my clean gloves so that I do not contaminate the wound at all. One swipe per piece of gauze. And then I will take another piece and I will pat dry the actual wound itself.